Well, May is National Brain Cancer Awareness Month, and so we wanted to hear from an oncologist about different types of treatments and different types of brain cancers. Joining us today is Dr. Haroon Rehman. He is an oncologist with Dignity Health Mercy Medical Group. And Dr. Rehman, thank you so much for being here.
Thank you for having me.
Can you talk about why this month, the month of May, Brain Cancer Awareness Month, is so important to start off with?
I think it's important to have these months to recognize certain types of cancers, so we can generate more awareness, both for from a standpoint of patients that can understand signs and symptoms, so we can have earlier detections, and so we can have screening for these types of cancers. And then also I think it's important to bring to the forefront the absolute necessity to fund research for a lot of these cancers. So I think those are important kind of goals that get accomplished when we bring awareness to these various cancers throughout the years.
Let me ask you about glioblastoma, because that's a sort of a rare type of brain cancer. How, if someone is diagnosed with that, how serious is it?
When we talk about general kind of occurrence, it is more rare. In comparison to other cancers, we see that in the United States there's about roughly 10 to 15,000 cases annually. But when we talk about subset of brain tumors, malignant brain tumors, more than 50% turn out to be glioblastoma. So it is something that I think from a standpoint of patients that have a malignant tumor, the greater likelihood that it will is that it will turn out to be a glioblastoma.
And talk about why, if you could, when you look online and you do research on the glioblastoma diagnosis, it says usually 6 months to a year life expectancy. Why is that?
Yeah, I mean, I think the biggest thing that comes back to the prognosis is the symptoms that are associated with these types of brain tumors. They're generally very nonspecific, right? So one of the most common presenting symptoms is simply just headaches, right? And so that often leads to detection being not necessarily detected at an earlier stage. So things can generally be more advanced by the time they're detected. There are certainly the second most common presenting symptom are focal deficits, stroke-like symptoms. And so by the time things have progressed to that point, obviously we can understand that the tumor is larger and more advanced at that time.
Is there early testing for it?
I mean, I think, for patients, there are a small subset of patients with glioblastoma that have a hereditary component. So if, for example, syndromes like Lee-Fraumeni, if that is something that runs in the family, those patients are going to be followed closely and undergoing surveillance imaging. But in the general population, this is, the occurrence is still rare enough that there aren't guidelines that would recommend, surveillance or kind of monitoring, brain imaging, for asymptomatic patients.
And where do we stand as far as like treatment goes for a diagnosis like that?
Yeah, so I think treatment for, glioblastoma is a multidisciplinary kind of a endeavor. It involves both, expertise at the neurosurgical level. It requires radiation oncology therapies, and then it also requires medical oncology therapies. So it's a collaborative effort, and that's a mainstay of treatment, beginning with first and foremost the attempt to get full removal or surgical resection of the tumor, and that is probably the number one prognostic factor as far as survival as well, right? The better ability to having the tumor in a position which it can be fully resected, patients will have better outcomes in that setting.
And we've been, for the last 2 years, following around a case of a Dignity patient, Jonathan Masterson, who has glioblastoma. If I were to tell you that he just hit the 2-year mark, what would be your first reaction?
I think the first and foremost thing would be, it's a reflection of the highest, level of care that he's received, the excellent level of care. Again, coming back to the expertise from a neurosurgical standpoint, to have, the tumor being able to be fully resected. I think, receiving excellent radiation treatments, receiving the chemotherapy that goes along with it. So I think that would be one component of things. Without that collaborative and high level of holistic care, I don't think that outcome could be achievable. And then two, I think a testament to the patient himself, right? There are things that when we take into effect, improving lifestyle factors, those are things that also help reach better outcomes from a treatment standpoint. That means referring to improving our physical activity levels, improving dietary habits. These are things that also lead to better outcomes for cancer care.
And the reason why I bring up 2 years is because there's a lot of people, the majority of folks don't last 2 years, right?
This is correct. So on average, the lifespans, even with treatment, are ranging in that 12 to 18 month period. So patients that are 2 years, and out from treatment and doing well, that's probably in that 15th percentile range. And so certainly, there's even further outliers. There are some patients that are in that 5-year mark, and that's less and less common. But I think he is definitely a positive a positive outlier.
Yeah, I mean, it just shows that if you are diagnosed with something so serious, there's hope.
There's hope. There's always hope, and I think that's the greatest part in oncology in general. There's always innovation and always research ongoing, and kind of pushing the needle towards hopefully getting to a point of cure for a lot of these cancers.
Dr. Rehman, thank you so much.
Absolutely.
May Cancer Awareness Month. Now back to you guys.